understand how to excel and how to master our performance, because the interview is defined as a performance. It's important that we bring and we sell ourselves as in the best of our possibility. So, first of all, we have to make sure that we research the right health board, the right trust. Okay, that is something that can be easily. We can have an easy access to several recruitment agencies that they can help us to match which kind of organization we would like to join and try to get an interview. So we've got a difference that it's important to value, especially the lifestyle and the quality time with our families. So it's not just to find a job. It's important to have a holistic vision. So I will say that it's important it's remarkable to understand where we are going, okay? Where we are going, and the website, the NHS jobs, it's the pivotal place where we can find all the vacancies for the NHS, which is, the National Health Service in UK. And the keywords for our research, they're gonna be for sure theater nurse, theater scrub, okay, operating room nurse and scrub. How to review our vacancy. So it's important to understand the hallmarks and the main characteristics for our job. Okay, every job description, when it's published on the website, they have got job description and personal specification. Once we are online to fill the form for our for the vacancy, it's very important to study in advance the hallmarks request in the job description and personal specification. So we have to meet certain criteria. Okay, all the criteria are in a kind of list, all written in the job description and personal specification. Filling the online form for the vacancy, okay, to send our description. It's important to create also not just an order of what we achieved, but especially some examples, real job life example of what we've done and what we achieved with certain numbers. For example, we have to include the courses, the certificates, and all the trainings that we got. But at the side of every courses and certificate, it's very important to reach a good score in this preliminary part when we send the application. It's important even to write the achievement in the daily life, working life. And I will say it's important, for example, if you did some courses for management, some courses, specify how you daily use those new skills, okay? For example, managing people, dealing conflicts, okay? Once we review the job description and we wrote additional information necessary to fulfill all the areas, we have to wait for the manager in charge of the theater department that we applied for, and ask for an informal visit. Once with the management we are agreed for the day and time of this informal visit, it's not just an introduction to the new team, but is to understand the expectation of the management about the new staff to hire. So the main question that I would ask to the managers during the informal visit is, what do you expect from your new team, from your new team member? What are the short and long-term plan for this theater, for your management? Because you, at the end of the informal visit, you want to study in depth all the information that they gave you, okay? For example, in theater, the relationship between theater staff, recovery staff, ward, bed, availability, all of these things you can discuss with managers. So you will leave an insight, and you can spend this additional knowledge during the interview. Okay. So the day of the interview, of course, it's very important, the dress code, and the approach, the body language with the panel. The day the interview, as you might know, you will always have 2 or 3 band 6 and 1 band 7, so a panel of 2 or 3 people that in a preliminary way, they organized certain questions, and every question has got a score level to hit the the highest score level. We have to make sure that we mention examples, working example, and especially keywords that we are supposed to bring in our interview. Okay, based on these keywords, based on the example, our answers are scored, give a value, and at the end will be matched with the best performing candidate. So following the slide sheet, the main resources that we got for sure comes from the code of conduct, the NHS code of conduct. So a part of this, we got our NMC code, the professional standards for nurses. So all the criteria that we have to meet about liability, professionalism, passion for improvement, okay? And for every question that they will ask you, it's fundamental. It's fundamental, it's pivotal to mention the patient, okay? The patients are the core and the center of our activity. Around the patients rotate all the process, all the caring process, not just in theater, okay? Then another question that basic, the main resources that we can find are the 5-step safety surgeries. Okay, so we have to be confident and competent in discussing, explaining, and timing ourselves, because we don't want to be too we don't want to talk too much about one point, but we have to go straight to the core, and then core to the questions, and then explaining with examples. So the 5-step safety surgeries is part of the national protocol that includes initial briefing, the safety briefing that we do for every session. Then the WHO checks, the World Health Organization check, safety list check, that is divided in 3 parts that we are supposed to know, we all know as professionals. Sign in, time out, and sign out. So at the end of every list, the importance of the debriefing, okay? And the debriefing goes in that macro area of the auditing process, okay? It will be very useful for the auditing process. Other resources are the national and local safety standard for invasive procedures. The abbreviation is NATSIP and LOTSIP. So they describe the protocols that we have to follow during every invasive procedures, and in theater is what we do. Then we have to be confident, competent in discussing how to face, how to cope incidents. Okay, the reporting process that can be written, verbal, and electronically made. So the data IT system. Okay, all of these are part of the main questions for a job interview as scrub nurse in the NHS, and not just in the NHS. Okay, so our aim is to score high, and as I said at the beginning, the interview is a performance. Okay, the interviewer, no, the panel, they don't know our background. Okay, they don't know our professional approach. They don't know all the courses and the trainings that we attended. They don't know how skilled we are. So it's very important to create a mental structure process to express with a clear method, all our skills. Okay. So working on keywords is crucial, because on keywords we base the scoring point, okay, the scoring level. We mentioned before body language, so how to approach and how to communicate that we are the right person and the best candidate of that session. Okay, so one of the easiest example to check our body language is to, as we can see here, is to make practice of our answers in front of the mirror. Okay, and we can tweak our approach. We can tweak our presentation. So the informal visit is essential, I would say, because we can have from the management, the people that will hire us, we will have an insight to the workplace, and especially some tips, the points that they want to focus our attention. Okay, we can even meet our future colleagues, and so it's always a positive impact that we give to the management prior to the interview. So we have to demonstrate that we got confidence and competence of our field in theater. Patient safety is the core. Everything it's around it, and we have to make sure that we communicate with the panel, that we are able to manage an effective communication. Okay, another important keywords: effective communication within a multidisciplinary team. How do we perform this kind of effective communication? Okay, we have to bring examples. Okay, in our working life, we have to bring example, very, very quick, very brief example, to show them that we are good communication, we are communicators, we are active listener. Okay, to be a good communicator, you have to be an active listener. So, and we are team players. So team players within the team towards our teammates, but especially we have to show them that we are proactive. We want to support the management. So be a team player has got a dual aspect within the team and also towards the management, because we must be able to support the management, especially to be in charge in absence of the band 6, in absence of the band 7, of the in charge. To do that, we have to always show that we know how to delegate appropriately and make an appropriate escalation process. The core is, as team member, as in charge, as deputy, or as manager, we cannot do everything on our own, okay? We have to rely on our team, rely on our teammates to deliver the best care for our patients. Okay, the core is always the patient safety and the care for our. So delegation, it's important, but it's based on competence and confidence of our colleagues, competence and confidence of the teammates. Once we realize that there are some issues or lacks, we have to address those and improve, empower our staff with additional trainings, with supervision simply, okay? But also be able to delegate at the right time to the right staff member. Then be confident in explain how the escalation process works. Okay. A good staff member wants to gather all the information and to sort at our level first. Once we realize, as staff member, as deputy, as managers, we realize we need scenario, the example, exceed our competencies, okay, we have to promptly escalate to the managers, okay, to the higher level. To do that, we have to be proactive. What we want to bring in the interview is that we are not just good communicators, we are not just motivators for the team, but we know how to manage every aspect of our job. And we know the right people to involve. So the escalation process is based on this. Escalation process means gather, be proactive, not simply report, but gather all the information, analyze the data, and then report to the manager with one or two, preferably, alternatives of solutions. Okay, for this reason, we show during the day of the interview that we know the process, but we are proactive as well. So you bring a report, and with you have got already a series, 1, 2, 3 alternatives to sort the issues out. And then the decision-making process will be completed by the manager because we did an effective escalation. During the day of the interview, we want to point the accent and the attention of about our continuous professional development, which means the courses and training that we already done, but looking to the future, okay? We give a look to the future and we see ourselves in 3 or 5 years to decide what kind of pathway, professional pathway, we want to undertake. Generally, in theater, as scrub nurse, you want to highlight the pathway that you prefer, which is going to be clinical or managerial. Within the clinical field, you will have the surgical advanced nurse practitioner, or also we can go towards the practice educational process. Okay, then so in the other pathway, the other pathway is more managerial. So achieving certifications, for example, taking the LEADS NHS program, or funding programs such as ILM, management and leadership and management program, that are a third-party courses, different level of courses, funded by the NHS and supplied by ACT, which is a third-party educational company. Once we do this, we want to, because sometimes during the interview, we got only few questions. For example, please let's talk about yourself and why you are the right candidate for this job. Then some scenarios, examples that then we'll do now. But sometimes what we want to tell to the commission, what do we want to tell to the panel, we don't find the right questions, the question that goes straight to the point. So we have to learn how to be concise, to fit inside every questions our specialty, our trainings and our skills. Okay. Then sharing the knowledge and lead by example are keywords that empower our presentation, empower our performance. Okay. Sharing the knowledge is not simply to attend courses and push our knowledge, but it's important during the audit days, during simple shifts, okay, to talk to our colleagues, understand their practice, understand if we are compliant with the most advanced and available practice. To do that, it's very important to weekly, I will say, check the health board or the NMC website, intranet for the health board, because there is the area, every health board has got an area of policies, okay? And the policies, they are subject to improvement, to updates over the time. So make sure that our panel, the interviewer, they know that we are able to lead by example. We don't simply delegate, but we are active listener. We are able to support our staff, our colleagues, sharing the knowledge and giving the reason why we adopt a practice. Okay, giving to the staff and to your colleague that you know the tools, how to use the right tools, how to research for those tools. And one of these examples is for sure the policies and guidelines of our health board, the NMC, the NMC code, and the NHS code of conduct. So you can mention those and the main hallmarks that they bring, okay, which is patient safety, professional responsibilities, passion for improvement, okay, and of course the be proud and pride in what we do. Going ahead, we go our target is to be the strongest candidate, of course. And what we want to highlight during the interview is that we are honest, we are humble, ambitious, okay, versatile, every adjectives that we can see here, quick learner, as we say, and team motivator, empathetic, approachable. What means? Means that everything is reflected on two ways. One towards the patient, okay? in every questions, we have to mention why we act like that, because it's for the patient safety. And from a second approach for the team, okay, to strengthen the team bond, to improve the care and the standards, high standards that we want to deliver our care. Then patient safety, dignity, respect, confidentiality. So we must be able to extensive talk about those topics. Where do we find the keys to discuss about these topics are the values and behaviors of the health board. And all of these values and behaviors are published, are public, and easy to reach on the website of the health board, the trust that we want to apply, that we are applying for. So another aspect that is crucial and is remarkable, will make the difference on how we perform and how we score during the interview, are the concept of problem solver attitude, so all the process, and the psychological safety. So to be a problem solver, to bring the attitude of a problem solver in theater, it's beneficial to mention some literature. For example, there are different methods of problem solving. The very popular one is known with the acronyms of PDSA, which means plan, do, study, and act. Basically, means that when we face an issue, okay, colleagues or directly, colleagues report to us, or directly we have to face an issue, the problem-solving approach wants, first of all, to have a clear and square, okay, square idea of what we do. First of all, we want to assess that the patient safety, the patient is safe, in a safe, stable condition. Gathering all the information that we got, all the information available. Once we gather all the information, we want to analyze those information, those data, and create alternative solutions. So we can face the issues in two different ways. Then once we got 2-3 alternatives, we have to pick the most effective one at that moment. So act. We studied, plan, act now. Once we act, it's important to remember as problem solver that there is a continuous assessment process. So within a period of time, we have to go and check how effective our solution is. Why? The meaning is that we have to amend, tweak, ongoing our solution, okay? Because there is not always one right solution. There is a range of solutions that we have to apply. And once the solution, the alternatives is put in place, we have to assess it. Once we assess it, then we have to evaluate the outcomes, okay, to improve it. So simply evaluate the outcomes. Psychological safety. During the interview, we make sure that the patient is the center of we deliver always our care, looking at the patient, center of our activities. Then we make sure that the interviewer, the panel, they know what kind of candidate we are, because we are active listener, we are versatile because we want to learn more, and we are good motivators for the team because we bring a positive approach, okay? And we are approachable, supportive. But the most important things is to mention the psychologically safety mentality, mindset. Psychological safety mindset. Working close to the human factor team and the practice educator, I daily see the importance of, especially during the audit day, to put the accent on psychological safety. It means that we promote within our team, within our management, at every single level, we promote the culture of speak out, the culture of being a good listener, but especially a good observer. Okay, good observer. Psychological safety means that every staff member, whatever is their role, they feel welcoming, they feel in a safe environment, and they feel how can I say strong enough to speak out, to talk to the team whenever they see that something is wrong, that something is not clear, okay? That something can be an issue, can be an hazard for our environment, for the patient safety. To be very extensive on this process, psychological safety is applied also, especially to the student ODP, student nurses, that they attend theater sessions. So a student must be welcoming. A student must be, we have to explain them the area, we have to explain them the environment, and we have to tell them to question the stuff every time they don't understand something. Every time they think maybe there is a risk for the patient, maybe the positioning of the patient is not ideal on surgery, on the surgical table, all of these little things, because they will help to improve the safety standard in theater. Okay, so be polite, be welcoming, positive attitude, sharing the information. Don't leave the staff member, especially new staff member, or as I say, the example of a student in an angle, but just show them, explain them the process, what we're doing. So when we say during the interview that we are aware and we daily apply the concept of psychological safety, okay, the culture of safety in speaking out, talking when we see something, not highlight, address to the in charge, address to the surgeon, address to the professionals involved in theater, that from your point of view, there is something not clear, something that can be an hazard, it's a great step to be successful during a job interview. Question and scenarios. Okay. The main question and scenarios can be the panel. First of all, most of the time, they will ask you, tell us about yourself, why you are the right candidate, what can you bring to the team? Okay. I suggest to fulfill these questions to create your own personal structure, mind structure. I tend to use abbreviation. For example, the ABC, A, my attitude. So I describe what kind of professional I am. I'm versatile, I'm humble, I'm ambitious, with A, no? With letter A, your attitude. Then I'm an active listener, problem solver, all of these objectives. And then you have to bring little example when you daily use this kind of attitude. Then I tend to use in the abbreviation ABC, A, the attitude, B, the background. What I've done, my background, personally, I qualified, I got my degree in Italy. my master in Italy. Then I moved in the UK after an experience in Italy of 6 months working in theater. I wanted to, so just to explain your background. Then within the background, all the skills, the trainings, the courses that you achieved, okay? And letter C, it might be the competencies. So you are competent and confident with specialties such as general surgeries, trauma and orthopedics, ophthalmology, and that's it. So just trying to create your mental map because you got a limited time. Having a limited time means that you want to be concise, but fulfill all the questions. With this kind of mental structure, we can cover all the aspects. And my example is the ABC abbreviation. So aptitude and background and competencies, skills. So you can fulfill the first question, why you are the ideal candidate. Then other questions can be how you manage a scrub nurse, circulator practitioner, how you manage a discrepancy in the instruments, in the swab count, sharp count. So we have to bring there our competence, that we got a clear idea, step by step, we know the protocol, what to do, okay? So it can be straightforward. Then another question, sharp injuries protocol, what do you do? Not just then to give a plus this answer, sharp injuries, generally you can see it in a direct perspective, but you can assist to a sharp injury. For example, surgeon working, there is a sharp injury, but maybe it's a junior doctor, is an assistant, doesn't speak out, is shy or not confident. So in that patient, you know how to deal, you know how to support. So this is a good point. Answer, not always answer the question, not simply directly, but also indirectly, what you will do if you assist at this episode. Okay. You let the panel know that you open-minded. Okay. You can see 360. The vision is 360 degree, not simply focus on yourself, but we are focused on the patient and on the environment. Another tip that I tend to give is to structure our answer based on 3 aspects. The aspect is answer the patient point of view. So I answer this question looking at the patient point of view, looking at the team or individual point of view, how I act, and look at the organization point of view. Okay. For example, we say the sharp injuries. Perfect. Patient point of view, what happened? Is there any contamination on the field for the patient's safety? Has the patient surgical site been contaminated? These kind of things. Then, and there are several others. Then, I'm timing myself as well, so I don't want to be too long. Then, patient point of view touched. Sharp injuries, team or individual point of view. Team means what I'm gonna do for my team, supporting them if they had sharp injuries, what I'm gonna do as individual if I've got the sharp injuries. And then organizational point of view, there is the report. There is all the ethics process, there is all the report to management, okay? And when we do report, we, for the organizational point of view, the third point, we want to make a note. Make a note and address those notes of improvements, notes of improvement. So for the next time, I suggest that we have to use the sharp pad in this way. We have to share the information with other colleagues because it can happen to other colleagues as well. So just to improve the practice, improve the protocols. Other questions, the ANTT techniques, they can ask you. They can ask you the cleaning, disinfection, and sterilization process, how to manage the specimen, okay? Different kind of specimen, we all know. Histology, cytology, microbiology, frozen sections, all of these we can mention and we can do. At the end, kind of support, we have to ask. At the end, there will be, even if most of the time, generally, always, the panel asks you, have you got any question for us? So always prepare a good question. The easiest one is what kind of support you will offer us, okay? And then what kind of funded programs, what kind of courses I can have from the health board, from the trust, because I want to achieve, I see myself achieving this level of management, or I want to undertake the clinical pathway. So I want to work through this process. So I think we finished more or less 41 minutes talking. I hope I gave you the right knowledge to open a bigger topic, a bigger conversation. Of course, I'm always available with my personal email for any explanation in depth of some topics that you would like to talk. And if you got now any questions, I will be more than happy to try answers as right now. Yeah, answer right now. Thank you.
Hello, everyone. Good evening, good afternoon, good morning, depending on where you are. My name is Nigena Jean-Paul from Kigali, Rwanda. So I would like to thank so much the presenter of the day, Michele Santoro, for his contribution in Theology Global. So this is the time, if anyone is having comment, question, this is your time. Thank you.
Hello, I just want to drop the questions on the chat box.
The chat.
I think, yes, there's a question on the chat box.
Okay.
This one is asking which forms to fill. I think the person has applied in NHS and the person has certificates. So the progress of any application failed for reason. I think maybe because I couldn't, the question is somehow, but I will just read it out. So the person is asking which forms to fill. I have applied in NHS and I have certificates. The progress of my application failed for unknown reason. The person is asking, can the person proceed?
Okay. So,
hello?
Yeah, I'm here. So I wanted just my speakers are not very good, so I just wanted to understand. You wrote in the chat box as well, yeah?
Yeah, the person wrote on the chat box. I'm just trying to read it out.
Okay. So you applied in the NHS and you have the certificate. The progress of my application failed for unknown reason. My advisor were okay. So let's talk first of all. You got your PIN number, have you? Hello? Can you hear me?
Maybe he's having network issue.
Yeah, I'm not the one that asking the questions. The person asked the question. So when you ask your question and answer, so I try to read it out. I'm not sure if the person is still online.
Okay, so you can have, the question is, you don't know.
I think the person is online.
Sorry?
I think the person is online.
Yeah. The questions are online.
Alex, can you unmute yourself?
Okay, possible questions you want to list. And then join. Perfect. Okay. The possible questions are in the PowerPoint that I can share with all of you. So, and we can read them, okay?
Okay.
Possible questions are, first of all, talk about yourself and why you are the right candidate for this vacancy, okay? This is the first question.
What will be the answer like this?
Pardon?
What will be the answer like this type of question?
Okay, the answer for this question, as I said before, is to create a mental structure. Okay, why you are the right candidate? The mental structure is, my suggest is to give you an abbreviation so you don't forget what to say. A, B, C. A, attitude. Okay, so you start and introduce yourself. Okay, my name is, I come from, then I'm the right candidate to this job because I am A, attitude you think in your mind. I am an active listener. I am a versatile professional. Okay, I care for my patients. Okay, then I'm a problem solver, and is everything written? Then I'll share. The organizer of this meeting has got the PDF file of the presentation. So, and is everything written here? We went through all the objectives that we can use. Okay, I'm a very ambitious person because I've done my master. I'm doing my continuous professional development. I'm an empathetic. So another keywords. All the keywords are written in this PDF presentation slide sheets. Okay, so I'm a team player. Why you're a team player? And you explain why. Okay, so you start answering the first part, your attitude. A, B, C, B, your background. So I got this kind of certificates. I'm working towards these qualifications. Okay, I've done the course for the strikers, for the size, for no, all the equipments or things like that that you use in theater. Then third point that you can use to fulfill A, B, C, competencies. Okay, I'm very competent and confident with sharing the knowledge because I've done the course for mentoring, so to support students. Okay, then why you are the right candidate to get the job? Because I master the concept and the method of psychological safety and problem solver. And you explain what's that. Okay, what we've done now, so this is the first question. Then we got other questions. How you manage a discrepancy with instruments count, swab count, sharp count. Sharp injuries protocol. Tell me about the sharp injuries protocol. What do you know about it? How do you preserve privacy and confidentiality? And other questions. Is everything written in the PDF that we've done? How do you preserve privacy and confidentiality? So first of all, be sure that we don't disclose information from the patient notes with the staff that they are not involved in the patient care. Always, for example, basic example, you have to say as a, I always close my account on the computers, always log out from my mails. I always use the confidential bin, dispose the documents in the appropriate confidential bin. Okay, then another question, tell me about the ANTT, aseptic no touch technique, and you explain the two parameters, surgical and not surgical, right? Then cleaning, disinfection, sterilization, what's that? Manage specimen, and so those can be. Then we can have other scenario that I'm thinking about. For example, there is a leak in theater from the roof, it's a small leak or it's a big leak, you're scrubbing, how do you manage? Okay, so first of all, as I said, it's important for you to remember when you answer a question, the 3 points: patient point of view, individual or team point of view, organizational point of view. So if in this scenario that they give you, there is a leak, patient point of view, what you will do? You answer and you say, I make sure that the patient is safe. Means if there is a leak, I will put an absorbable pad or a bucket or a sign. I will put a sign there. But if it's a big leak, I will straight ask to change theater, to stop it, because it's not safe for the patient. Okay, might be electrical items involved in, and so there will be an accident. Okay, then this is patient point of view. Then we got individual team point of view. I make sure that my colleagues, they are aware of the hazard, this leak. And we use, if we use a bucket, we have to use a sign, we have to use an absorbable pad, and we use the right one, because there are some absorbable pad specifically designed for the floor because they are not slippery, and some designed for the patient, okay? The IncoPad, for example. Those, if you put that on the floor, they will be slippery. It's a double hazard. So, and then organizational point of view. Organizational point of view, I report. I make sure the management of what's going on. I make sure that is reported to work and state department because I want to know when they sort it out. On top of this, we have to make sure that the day after, the week after, the theater is used. The theater can be used or not. So this is another question that we can use. And so what I'm giving you are the questions, but especially the mindset, how to approach and fulfill every question. Okay. So to introduce yourself, because you are the best candidate, ABC. Attitude, all the adjectives that you got there. Background, all the courses, all your work experiences. And C, competencies. Then, for each question is important, 3 points. Answers, patient's point of view, team, individual point of view, organizational point of view. Okay. Let's see some other questions. I suppose we answer more or less.
Thank you so much, Michele, for this brilliant presentation.
Yeah. For any advice about NHS number, because it's important, as I said at the beginning, when we do our application online, in the additional information, it's very important that you write the additional information against the job description and personal specification. So any job description, any personal specification has got certain points. And when you write the additional information within the electronic applications, you have to fulfill that areas. In this process, you got high chance to get shortlisted. When you are shortlisted, you don't go simply to the interview. Before, in advance, you ask for an informal visit to have an insight, to have some tips. What are the areas that they prefer to focus the attention?
Okay, thank you so much, Michele, for brilliant presentation.
Pleasure.
I think the time is very short. It would be better if you give us a personal email in order to keep in touch. Yeah. And then, Greg, thank you so much. I wish we shall have another session in order to have more information about NHS system. So let's welcome the president of TORG, closing remarks. Thank you.
Thank you so much, Jean-Paul. I really want to say thank you, Michele, for the presentation. It was very straightforward. You mentioned the key aspects that is needed, especially in terms of aptitude, background, and competencies that you mentioned. Those are the areas that the employer is really going to be looking at for interviews to be successful and other things like that. You emphasize delegation, escalation protocols. Even in Ireland, they emphasize those areas as well. You have to know how to escalate things. Like, they don't expect you to know everything, but provided you know how to escalate to senior line managers and know how to put things appropriately, you know who to report to in case there is any issue, which is exactly what you mentioned. You emphasize continuous CPDs, sharing knowledge, and most importantly, acting within your scope of practice, which is really, really good, because even any scenario, anything you're mentioning, any aspects you've been asked to clarify, it has to be within your scope of practice. And as much as possible, one needs to project oneself as a professional and as knowledgeable as, because it's not just going to be competency based, like you mentioned, knowledge would be very, very essential as well. So I must say thank you so much, Michele, for that presentation. I believe, as Jean-Paul said, the time was very short. Hopefully, we will bring you back in for another stage of that presentation, maybe in terms of requirements from scratch, and so that's because a lot of information is out online. People don't really want to get scammed, especially when you want to travel from one country to another. You want to know where to get the right information and how to do that rightly. So definitely, thank you for sharing relevant knowledge. We look forward to bringing you back one of these days. I think maybe early next year for a second part of the presentation. And I must say thank you to all the leaders of the Education and Training Committee of TORG. Idris is here. He introduced at the start, and Jean-Paul is here as well, and all the leaders that are unavoidably absent today. And I really want to say thank you to everyone, all the leaders and members joining us from different countries. I think we have people from Pakistan, Rwanda, Nigeria, and not sure, and more. Thank you so much for the registration, for taking the time out of no time to join this session. We always have a webinar in 2 weeks, every 2 weeks. So there is going to be another one. I think the next one would be on pain management. So that was a brilliant presentation. Thank you, Michele. Thank you, everyone, for joining us. And good morning, good evening, good night. Anyway.
Thank you so much.
Thank
you so much. I just wanted to add one thing.
Okay.
For the requirements to get the NMC number, UK PIN number. I mean, for the I'm qualified scrub nurse registered even also in Malta, island Malta. So I'm happy to share the right documents and the right tips to apply for the professional bodies in UK and in Malta.
Thank you so much. That's brilliant. Thank you so much. Yeah. Thank you. We will definitely bring you back to continue the presentation. Thank you, everyone. Bye, bye, bye.
Thank you, all the best. Thanks for having me.
Thank you so much.
Bye.
Thank you so much.
Bye.